What was life in prison like for you?
It was all right, boring. It was boring, and what the worst thing was the lack of total freedom and the snoring. Boy, there are a lot of people snore in prison.
Well, Jack Kevorkian might not have liked prison, particularly the total lack of freedom. Isn't that what prison's all about?
Right. There's so many other things to complain about. But he complained about the snoring.
I didn't like the total lack of freedom more than the snoring. But regrets, he has none when it comes to helping terminally ill patients take their own lives. Kevorkian was dubbed Dr. Death for his assisted suicides, which landed him in prison. I had a chance to sit down with him and get his take on Michael Jackson's death, his life behind bars, and whether he is now out of the assisted suicide business. You spent 8 years in prison. You were convicted of second-degree murder for assisting in the death of Thomas Yauk. I guess it's a very basic level. The goal of the prison system is to punish people for their crimes and to try to convince them to never, ever do it again. So I'm wondering, I'm curious, if someone were to come to you and say, Dr. Kevorkian, I want to end my life, I want your assistance, would you help them to commit suicide to end their life?
Not now. It wouldn't serve any purpose.
So you've changed
the world all knows. The world knows about it. Everybody knows about it. And anybody who does it now will just end up in prison. It's not worth it.
So have you changed your mind about assisted suicide?
No. I've changed my mind about suffering in prison for nothing. You can't listen. The issue is settled when the ice is broken with one case. You know, now, everybody knows about it now, but nobody can do it. They're afraid to death because the law will punish them. It won't solve anything. It won't change anything. The people have got to demand this right.
Doctor, if you had an opportunity to rewind the clock, would you have done anything differently?
Yeah, I'd have done it earlier.
You'd have helped people to die earlier?
Because it's better. Yeah, well, I would have done it earlier in my life because it's not good to have all this commotion near the end of your life. I'd rather have been younger. I could have taken everything a little easier. Prison wasn't that hard on me. I was surprised. When you know you're not a criminal, prison's quite easy, in fact.
So in terms of helping people to die, in terms of assisted suicide, you have no regrets?
Why would I have regrets? That's my duty. I'd be pleased to have done my duty. Not like other doctors who cowardly turn away.
Let me ask you, Dr. Kevorkian, about the Michael Jackson case. As you know, his doctor, Conrad Murray, is under investigation. Potential manslaughter charges are what he could face because it's alleged that he gave Michael Jackson a dose of Diprovan, otherwise known as propofol, that contributed to his death. Do you think that he should face charges for his role in the demise of Michael Jackson?
Well, I don't know anything about the case. I don't know any details. In fact, I'm not even following it. I'm not connected with it. And who knows? You got to have the details. You got to have the doctor's notes, medical notes, and see what he said, what he did, and what he said. I mean, did Jackson demand the drugs? Did he demand higher dosage? And the doctor might have refused it, and then Jackson probably would throw a fit. Who knows? And I think he was trying to conform to the patient's wishes. That's what a good doctor should do. In that case, I could not blame him for doing it if the person wanted. Jackson was on a suicide campaign. He kept that up. You know he's going to die. Multiple drugs.
So is it right for a doctor just to say, it's what the patient wants, this is what I'm going to give the patient?
Well, that's not a blank check. It's a right for the doctor to conform exactly to the patient's wishes as long as it's in conformity with regular medical ethics. Simple as that. The ethics will control the profession, not law.
And that is the big question when it comes to Dr. Conrad Murray. Was he inside or outside the bounds of normal medical ethics?
Right. It's also interesting, Jack Kevorkian, when you asked him would he do it again, and part of him feels like it's just not worth it to go suffer in prison. He said, I did what I thought was right, but no one's coming along with me here, and everybody else is cowering and refusing to do it.
And now that he's been put in jail, it has set the precedent that anybody else who does what he did will get thrown in jail as well. So always interesting to catch up with Dr. Jack. It's been a long time, about 10 years since I last talked to him.